See, I will be doing adjustments here. The first adjustment, I will be doing the seated occiput adjustment for left rotation restriction. So first thing I'll do is I'll be checking for rotation restriction. I'll go over here, left rotation restriction. All right, and then I find that it's restricted on the left over here. So then I'll have my hand kind of angled downward so then I can have the vector going this way. My hand on the mastoid fossa, and then I'll let it flex over, rotate until I open. And then right there is the pose. And my vector is going to be P to A. And then the second adjustment I will be doing for you is supine, right TMJ, piezoform condyle, long axis distraction. I'll have my patient laying over here. And then it'll be for the right TMJ. Yeah, pretty sure you can see. Okay, so then first I'll rotate the patient over and then test TMJ to see if there's restriction like this. And then when I find it, I'll distract the head a little bit, put my piezoform on the condyle, and then I'll have a LAD thrust to perform the adjustment to force the LAD. And then the next one is going to be prone T6 right rotation restriction, right lateral flexion. So then I have my patient face down, please. And then face down. Oh, so first I'm going to have to assess, and then I'll have my patient do that. Extend forward and then press. And then I see this extension restriction. I'm going to have you flex over. And there's right lateral flexion restriction. Rotate to one restriction. So then I'll have my patient lay face down. And then using my right hand, since my right hand will be able to create that clockwise torque, I will find my segment on T6. So go down T6, and then I'll put my piezoform on, rotate. So then this clockwise torque reinforced with my caudal hand. Have the patient breathe in, breathe out, and then like this. I'll make sure I have a bear claw so that I can grip the spine like that. And then I will have them breathe in, breathe out, and then my vector will be P to A with clockwise torque will be built in. After that, I will do the supine right glenohumeral stretch assessment. Okay, awesome. Right hand is going to be over here. So then what I'll do here is I'll first move this up for the patient comfort, and then I'll assess for internal rotation and then external rotation as well. Oh, and then here I see there's a little bit of internal rotation restriction. So what I'll do here, I rest the patient's arm on my leg, and then I will rotate my patient, stretch him up into internal rotation, and then quick thrust at the end, and I will do that 3 times. 2, and then third one, 3. And that's the glenohumeral internal rotation adjustment. After this, my next adjustment will be the seated right radial head P to A pronation restriction. All right, so then the right radial head will be the right arm here. And then what I'll do is I will, in order to assess, I'll pronate and then kind of stress the radial head to see if there's restriction P to A. When I notice there is, I'll bring the patient arm back, pronate fully, contact on the radial head, and then my thrust will be straight P to A through the radial head to induce that restriction. Next one is going to be the seated proximal row flexion restriction on the right. Seated proximal carpal row. Right carpal is going to be over here for flexion. So then here I will find the carpal that I'm looking for, and then I'll stretch, or stress, and then when I notice there's a restriction P to A and flexion right here, I have the patient lean back, put my finger on there, reinforce the thumb, and then boom, P to A on that carpal. Okay, the next one is going to be the supine TL junction extension restriction. This one I'll have my handy dandy thoracic board, and then the first thing I'll do is have the patient seated, and I will assess for extension restriction of the TL junction. Let's do it from this way so you can see. Have the patient lean into my arms, find the TL junction there, boom, and look, there is a little bit of restriction in the TL junction here. I'll put the thoracic board not too close but not too far so the patient can have room to extend back and then far enough so it doesn't hit their back on the way down. I'll find my contact there, have my patient cross their arms like so, contact, compress, and then have my patient breathe in, and then on the way out, I'll lean them back, and then from here, boom. My vector would be P to A. Okay, and then my next adjustment is going to be supine, right hip internal, wax on, wax off. All right, so the patient will be supine. And in order to do this one, I will first assess for internal, external rotation. From here, I'll go internal, well no, this will be external rotation, and then internal. Then there's some restriction here, so then I'll have my patient relax their leg. And I'll do like a wax on, wax off, really like this. Abduct their leg a little bit, and then lean back, stretch, and then from here I'll do a LAD adjustment to induce internal rotation. And then from there I will do, I will do a prone P to A restriction, the right fibula head, reinforced piezoform pull. Have my patient laying down on their back again here, and then the right leg. Right leg is over here. So I'm gonna bend the patient's leg up this way, and I'll grab that fib head, move it back, move it forward, and I find that there is a P to A restriction on this side, so then I'll have my patient turn prone or onto their stomach, adjust this for comfort, and then I will flex my patient's leg up like so, rest it on my shoulder, I'll stress it out, and then put my contact onto the fibula head, reinforce with my other hand, distract, and then thrust. My thrust would be going from S to I. Technically P to A, but it looks like S to I there. And then from here, I will do a right first metacarpal MCP dorsal planar dorsal. Oh, this is the corkscrew one. And then let my patient fan off their foot a little bit. That's cool. From here, I will brace on the carpals, intercarpals, tarsals, yeah, carpals are there. And then I'm using my claw grip here, corkscrew grip. I can rotate to see which way, rotate this way, flex, extend, do all that to see where I find the restriction. And then when I find the restriction, I can turn and then pull. And that will be the corkscrew. That concludes all the adjustments. Thank you. And thank you, Lee.